Welcome, everyone. My name is Jillian Armstrong, and I am the Interim Executive Director for the County Foundation. Anne, would you like to introduce yourself?
Sure. Glad to see everybody here. Anne Van Black from the County Foundation, and my role is the Vital Signs Coordinator, so I'll be doing the bulk of the presentation today.
Anne will be the one chatting. So welcome everyone today. I'm just going to do a little brief introduction to the County Foundation for anyone who is maybe perhaps unfamiliar with the work that we do in the community. And also just as a good little refresher, we've got our hands in lots of pots all the time. So in our case, we are the Community Foundation for Prince Edward County. We're part of a network of community foundations from across Canada. There's about 208 of us. And essentially, we leverage philanthropy in our community to make it a better place to live for all that live here so that they can thrive. We have three primary activities that we're involved in. Vital Signs, which we're going to talk a lot about today, where we collect local data and produce vital signs reports. If you've not checked out a vital signs report previously, I'd highly recommend it. It's a great snapshot of community well-being, looks at areas like education, health, transportation, a variety of different key areas worth examining. So if anyone's new to the community, it's also a great introduction to Prince Edward County and what the needs are in the community. We also manage charitable funds on behalf of donors. So our grants and funds are, I'd say we're most well known for our grants as well as vital signs. So the grant programs, we administer programs on behalf of the municipality, manage funds on behalf of donors, and disperse grants that are in support of the amazing work of organizations working in our community to make it a better place. And lastly, collaborative work. As I mentioned, we have our hands in lots and lots of pots all the time. We are involved in a variety of different initiatives, and that's been focused on food security, transportation. We have ones focused on health, and so really we use that vital signs data to inform the work that we do in the community, both from the grant side and our collaborative work, and work with a lot of amazing partner organizations on moving issues forward and moving the needle. So that's a little summary of the County Foundation. So I just wanted to kind of provide that as a little bit of an overview. But I'm going to turn it over to our wonderful Vital Signs Coordinator, Anne Van Black. And so Anne, really kudos in terms of the work and effort and putting together reports. And so this year we're focusing on our 2025 report. And I'll just flag that in 2024, we produced a retrospective report. The first Vital Signs report was published in 2013. So it had been officially over 10 years since that first report had been published. So I'd recommend if you're unfamiliar with vital signs, that could be a good introduction because it gives that 10-year perspective on how important vital signs has been for the community and continues to be. But Anne, I'll sort of turn it over to you to highlight the 2025 report, which is really what we're here to talk about today.
Thanks, Jillian. And I apologize. Today I've got a scratchy voice, so bear with me here.
The time of year.
Oh, indeed, seasonal allergies. So I just wanted to mention too, in regard to vital signs reports and data, it seems that the more data that we produce, the more that local organizations are asking for. So it's a never-ending cycle, but it's a good one because that data is being actively used. So I want to get a sense of the audience today as well. So maybe just hands up. Jillian, I don't know if you can see all of the screen or not, but I want an idea of how many people are here from local organizations. Just hands up. Yeah, so quite a number, and thank you. And are there representatives from the municipality? So we're represented there too. That's great. And local residents who are interested in this information. Yeah, that could apply to just about everybody, right? As well, even if you're not attached to an organization. So thank you, everyone. So I'm just going to start sharing the screen here. So this year, the Vital Signs report is a focus report. So we produce those between census years, and it allows us an opportunity to dig a little more deeply into some topics. So the topic this year is social infrastructure. And that an example of social infrastructure is public spaces and services that bring people together. That could be, for example, parks and libraries, community centers, et cetera, and how those affect our connection, inclusion, and well-being in Prince Edward County. So this report, for the first time, uses GIS mapping, that's Geographic Information Systems mapping. We've created some of our own mapping. The municipality has shared mapping, and we also have mapping from other organizations as well to display the data in a different way. So we combined that with the data along with community input to show how population patterns and access to that social infrastructure affects well-being across the county. So I want to mention too that I welcome questions. And as you think of questions, perhaps just pop them into the chat, and we'll try to address those at the end. And the slides. We'll be sharing these slides. We'll send an email to registrants afterward with the slides and a link to the Vital Signs report. So you don't have to madly create notes. So just some highlights of what we'll be looking at today. Defining social infrastructure a little more granular manner, and how our community is creating spaces to connect. Also, what are some of the barriers to connection and participation? If we're aware of them, we're more apt to be able to reduce those barriers. And also some examples of how mapping is used to show what our community assets and gaps are. We'll also be taking a brief look at People First community and neighborhood design. And there's some stories, community stories. I always love those about how resourceful our community is, some examples of that. And then from the community input, there's some insights and calls to action that came from that. And then a brief what's coming next, and an opportunity for questions and answers. So social infrastructure, just a little bit more background on that. It's really the backbone of community life. It's our parks, schools, healthcare, housing, and all the systems that help people stay healthy, connected, and involved. And so for the purpose of this report, the social infrastructure was divided into 3 areas. One, places for social care. So examples would be hospitals, schools, childcare. And social and cultural infrastructure, that would be libraries, museums, art centers, community centers, recreation facilities, parks, and green spaces. And I might have left some out there. And also other essential infrastructure, which isn't technically social infrastructure, but still very important in our respective communities. Examples would be grocery stores, fuel stations, banks, or ATMs, which unfortunately we're losing more of. Sometimes you don't really appreciate what you have in your community until you have, until there's the fear of losing it. So creating spaces to connect, and why social infrastructure is so important to well-being. So it's our shared spaces, the places where we cross paths with each other, where we connect and share our lives, that community truly comes alive. And I sometimes think about just going to the local grocery store and the people that you run into and the chats with cashiers. And I had one new resident that told me that during the pandemic, that is really what kept her going with so much social isolation. It was one place where she could make connections with people. So it's also the networks of support that we can count on, that sense of identity that reminds us that we're part of something bigger than ourselves. So take green spaces, for example. Access to green spaces has been shown to increase people's sense of belonging by 1.5 times. That's significant. And if you recall during the pandemic, just how much people craved to get to those green spaces. And it just felt like half of Toronto wanted to be here in our green spaces. So those shared spaces don't just bring us together. They create opportunities for civic engagement and that deep sense of belonging that we all need. And it's through those connections that our community builds resilience, the kind that helps us pull through the hard times together. And we've seen that again and again. The longer you've been here, the more examples that you'll probably be able to think of. But I was thinking during the flooding of our shorelines in Lake Ontario, we had a couple of years of bad flooding, and the community came out and helped sandbag those shores. A lot of hands that helped with that. Or during the pandemic when neighbors helped neighbors to get through those lockdowns. So that's what community looks like. It's that connection, that care, that collective strength. So barriers to participation and connection. I need to know what they are so that we can really be awareness helps us to reduce them. Those barriers exist everywhere. Prince Edward County is no exception. But loneliness and social isolation aren't just personal challenges anymore. They're now recognized as a serious public health issue that affects people of all ages. And it can even increase, loneliness has been shown, it can even increase the risk of early death. So our parks and our community gathering places aren't just luxuries and add-ons. They're critical to our quality of life. And there's many reasons why it's becoming harder to connect. The pandemic really separated us. Many people haven't really fully socialized since then, especially seniors or those with vulnerable health conditions. Remote work, also moving services out of our smaller communities. Look at schools centralizing, some of the healthcare services moving out and being centralized. Those are examples. Services moving out of our smaller communities have made face-to-face interaction less common. Also, online platforms, sometimes replacing deeper relationships. And when we lose community gathering spots like local cafes, community halls, or places of worship, casual interactions disappear. And then you add in our car-focused community design. If you have lack of sidewalks, for example, or suburbs that are built for cars where it's just garage doors at the front of houses and no porches for people to meet up with each other easily. Then you've got growing divisions, declining trust, housing instability, and lower civic engagement. Then it's easy to see why community ties can feel weaker. So here's an example of some of the mapping that was produced for this report. This map shows population density. For those most familiar with the county, probably not surprises. The darker areas on the map show the most densely populated areas, so you can clearly see Picton in there and Wellington, especially Wellington on the lake. You have other population centers like Bloomfield and Rossmore, and then along the Rednersville Road on the north shore. So that shows the density of the population. But looking at that a little more depth, we're considered a rural community. So we have just under 27,000 people now, spread across over 1,000 square kilometers. So that's about the size of the Greater Toronto Area with that small population as taxpayers. So the challenges really, we have challenges in terms of distance, limited public transit, and fewer gathering spots. And so those things can make it harder to stay connected. So this map also shows the main transit, the scheduled transit route, which goes from Picton up through Bloomfield, where there's a bus stop and shelter, up through to Belleville, where people can make more connections. And then on-demand service provides service from anywhere in the county. So that's really an important aspect of making it easier for people to reach services and activities and social opportunities. And that work to extend the public transit is ongoing. There's upcoming consultations in Wellington in the near future. And I wanted to share a story too. I was at a public transportation. It was a community consultation, community conversation. And one of the ladies I chatted with teaches at Ottawa U. and she now has to use public transit for her whole route because she's lost part of her vision and she can no longer drive. And it's not easy. She has to be there in person a couple days a week. And so imagine all the connections that she has to make for public transit. But without county transit, this would be impossible for her. She would not have been able to continue her work. So really important. It can be life-changing for some people. So another way to look at mapping, this map shows population distribution by age. And so the darker green areas, mostly around the perimeter, are the more concentrations of senior residents age 65 plus. And as you know, in our community, seniors comprise now 35.2% of our population, much higher than Ontario, which is 18.3% of population are seniors. So when you look at, we know what those numbers are, and that's the proportion of seniors, but what we may not have realized is where they live and how that can affect service planning. So with so many seniors living in the outlying areas, it really it drives home the fact that we really need to have services for home care, transportation, and outreach services to reduce isolation and help older adults age safely and comfortably at home. So this next map, this is a bit of an update from what you'll see in the report itself, always acquiring new data. So this map shows access to hospital emergency rooms. In other words, the areas show the population that's most likely to use Prince Edward County Memorial Hospital for emergency care. So that's the darkest areas. Lighter areas, the lighter they get, the more apt they are to go to other hospitals for emergency care. So that would be Trenton and Belleville in most cases. So the Ontario Health Team is using maps like this to help plan how healthcare services are delivered. So they look at population density and how close people are to different types of care and where they're receiving that care. So some good news out of this is that the provincial health data, that's where the main data comes from, plus locally. As you probably are aware, our local health unit, Hastings Prince Edward, has recently been amalgamated in as the Southeast Health Unit. So more our local health data is aggregated with that larger region, which really doesn't help us for planning. So there's the Hastings Prince Edward Ontario Health Team is working on acquiring neighborhood health data. So we're working closely with them, and I'm hopeful that we'll be able to get more data specific to Prince Edward County and perhaps even a more granular way in areas within Prince Edward County. So that's some hopeful news on health data. So another map in the report is proximity to childcare. So on this map, the green areas show neighborhoods that are closest to registered childcare centers, and the red areas highlight places that are furthest away. The white areas, there wasn't enough data, but you can surmise that those are also far away. So more than a 15-kilometer drive. So for families that don't have childcare nearby or childcare at all, it can make balancing work, education, and caregiving much harder. And just an update, the Hub Child and Family Center provides 176 full-time spaces across its 2 sites in Picton and Massasauga-Rednersville. And as well, they provide home child care, but there's also after-school care at most of the schools. But the demand is growing. The waiting list jumped from 155 in 2021 to 350 today. That's actually gone down since last year. I asked the Hub why the list had actually decreased since last year. And apparently people have either decided not to go back to work, or they've found other things, other ways for their children to be taken care of, or in some cases, they've combined one parent would stay home and watch the children of several of the parents who returned to work. So different kinds of solutions for for childcare, but it's definitely don't have the capacity. So really where that lack of capacity came from is during the pandemic, our population had a bit of a boost in younger families, and there was more growth in the age 0 to 9 age group. So some good news in that there was some announcement yesterday that 49 new childcare spaces will soon be available at Base 31. And that took a lot of community work to pull that together. So in the report, there's also other mapping that shows proximity to public school education and also to cultural centers such as libraries and museums. And in the report, there are links to interactive maps for those that really would like to see the more granular detail in those. We'll be using mapping more going forward as well. I anticipate in the next vital signs report after the census, that would be in 2027, that we'll be able to use mapping to be able to really visualize and analyze the data in ways that we haven't been able to do before. So, connecting neighborhoods, people first community design. Really, Prince Edward County, with the development that's happening here, whether we like it or not, it's happening. And we have a real opportunity to make our community more human-centered, shaping new developments while also bringing life to underused public spaces in our neighborhoods. And so some specifics on that. Key ideas would include streets and paths that are walkable with safe crossings and slower traffic and good lighting. Public spaces and facilities that are easy to access with parks, seating, and places to gather. I remember my mom, who lived in Picton, west of Picton, mobility issues as she aged, and she said that she just didn't have the stamina to walk all the way downtown. If there'd been more places to sit, that she could probably more likely have done that, and that would have opened up a lot more social opportunities. Mixed use spaces where housing, shops, services, and recreation come together. New neighborhood designs that invite social interaction rather than being designed for cars. And again, back to that reference of big garage doors being at the front of your house and no porches. So design that works for everyone, no matter their age or their ability. And there's many local initiatives and organizations that are already working to make sure that our new housing developments and public spaces put people and community at the heart of those designs. So this is one of my favorite parts, looking at how resourceful we are in this rural community, always finding creative, resilient ways to connect with others. And so just some short stories on these. Delhi Park, that's a 28-acre green space right in the heart of Picton. And it's enjoyed by tobogganers and cyclists and pedestrians, dog walkers, and anyone connecting from Macaulay Village neighborhood to Main Street Picton. And so plans are now underway to make the park even better with improved pathways and lighting and seating and signage and recreation trails and accessible features like handrails where needed. So Athol South Marysburg Public School. A lot of young families had moved into that community, and there was certainly a shortage of playground area. There was just one small park at the boat launch. So thanks to strong local advocacy, the playground now is open to community outside of school hours. So this shared use approach gives young families the much needed play space, but it makes the most of existing resources without building new infrastructure. So another great story is the new County Senior Center. So that opened officially in July of this year. That space is tucked in the back of, on King Street, the Community Care for Seniors office. This was unused space that was tucked in behind their office. Community Care was renting that space, so they didn't have access to this area behind. But in July, Community Care purchased that building and has now been able to open up this community center. And since they've done that, hundreds of seniors have been taking part in activities that keep them active and connected and engaged. And Terry Sprague, who is a regular attendant, he lives alone. He calls the center a life changer after years of pandemic isolation. And another participant, 95-year-old Leslie Toth, now works forward each week to walking over, chatting with friends, and sharing his craft. And Leslie was a tailor, and he actually made a custom cap recently for Gary, the coordinator here that you see standing in the foreground. And at the bottom, in Macaulay Village Park, picture both of the park and the new play area there, and then a group that's been actively involved in making that a better place. So that area was once overlooked. There's about 4 acres there, and it was mostly just green space and old playground equipment. So now it's become a year-round hub for the community. It was community-led redesign, and they brought in trees, gardens and pathways, a playground and a shade structure, and transformed it into a welcoming place for play, rest, and connection. And now they host events, workshops, and festivals that bring the neighbors together. So that was a real community effort. So some of we gathered a lot of insights and feedback from community during conversations. We also did interviews and a community survey. So these are just examples of some of the things that we heard. We really tried to make sure that we're hitting all corners of the county, north, south, east, west, and central. And so in the report, you'll be able to see those more clearly. These are just examples of them. So we need to turn those insights into action. So there's ways that every one of us can really help to create inclusive spaces that welcome everyone. I think a big part of that is just being aware of the importance of those spaces, but helping to activate public spaces. Recreation committees and service clubs and others do a wonderful job of creating events and improving those public spaces. Mentoring or supporting community champions, those who are leading the way. And volunteering with community building groups. There's a lot of skills in this community that can certainly help with any of those initiatives. And supporting initiatives that prioritize inclusion. So when you think about these spaces, always being aware of, will they benefit everyone of all abilities? Certainly, there's more and more accessible playgrounds, for example, and accessible spaces, which is great. And also sharing this report with others. And you can find this report online at pecdata.ca. There's a QR code there for that as well. We'll be sharing the report after. We'll be sending out an email after this presentation. There'll be a link to the report in there as well. So I also wanted to draw your attention to another new initiative this year in regard to data. So online at pecdata.ca is the Vital Signs dashboard. And Vital Signs used to be periodic reports, especially after census years. In the last 2 or 3 years, it's really becoming a year-round initiative where data organizations are looking for data continually. They're using it for advocacy, for grant applications, and just informed decision making. And so the data at this website is updated monthly. And we just added a new component to it this past year based on feedback from community organizations who said, there's so much data there that sometimes I have trouble finding, what I'm really looking for. So we created a well-being dashboard. It's the first icon that you see there. And that gives a very quick summary overviews of the data that's available in the dashboard. And in there, you can more easily see trends. We've been able to track data in a lot of cases right back to 2006, trending through to current. And it really helps us to identify trends. That, by the way, that well-being dashboard that's a collaborative effort, working with community organizations to help to understand what data they need. And so this is really the beginning. It's we just launched this in July, and we'll be continuing to improve it over time based on feedback. So what's next? I wanted to draw your attention to an event upcoming, an interactive workshop on November 20th. It's free to register, and Jillian is going to share the link for the registration in the chat. So that's interactive. It's a 2-hour presentation. It's at the Prince Edward Community Center, and it's about seeing what's changing and planning what's next. And so with that, we'll be looking at thought-provoking indicators that showing how our community might evolve over the next 5, 10, 20, or even 30 years, and how we can plan proactively. So should be some interesting conversations, because there will be conversations with participants at the respective tables. And there will also be guest speakers to give updates and a look ahead on housing, healthcare, and transportation. So this is open, it's free, it's to anyone interested in our community's future. And that might be local community and economic developers, service organizations, or residents curious about what's changing and why it matters. So I would encourage you to attend that. If you have any questions, please don't hesitate to reach out and ask me about that. So questions. Really happy to address any questions that you might have. I'd like to give a shout out to our Vital Signs sponsors. Without our sponsors, we wouldn't be able to do the amount of work that we do with Vital Signs. And sometimes, as I get requested more and more data, I think we can never do enough. And I'm sure every local organization must feel that way. But these sponsors really help us to be able to maintain and continue to provide better data continually. So the municipality, Wilkinson Chartered Accountants, Base 31 PEC Partners, Connor Clark and Lunn, and Community Foundations of Canada all help us to support that work.
Thanks very much, Anne. So we haven't received any questions in the chat, so maybe we'll open up the floor, but I'll just highlight some of the messages that are in there so far. Kathy had highlighted our community association has partnered with our community church in our rural area to hold community socials. We have quite an elderly demographic in Westlake, and these socials have brought neighbors together, and response has been very positive. We hold them through the fall and winter months, last Saturday every month for a couple of hours. We encourage neighbors to bring neighbors if they are not mobile. And so I think, that highlights a lot of the things that we've been talking about in terms of, utilizing shared spaces, bringing people together, assisting with accessibility challenges and how to overcome those barriers. And in this case, even, getting people to help out their neighbors. And so that creates further social opportunity. So that's so great.
What a great example, Kathy. I'd like to follow up with you if you're good with that. Okay, thank you.
And then John Hirsch from Council shouted out that yesterday that there was some good news shared around childcare expansion efforts, that 49 new spaces are opening up at Base 31. So a little bit of background, the Hub has been working on expansion of childcare for quite a few years after, unfortunately, there were spaces that they were looking at that, it didn't move forward. And the County Foundation actually acted as a connector in that role. And so we're able to bring Base 31 and the Hub together. It's obviously taken a few years to come to fruition, but had also received funding through our Vital Impact Fund, through the Huff Family Fund, one of our donor advised funds, as well as a donation of $100,000 from an anonymous donor also through us. So I was so thrilled to have that finally announced. It's really much needed good news for the community. But as Anne has mentioned, there's a wait list of 350. So 49 spots is amazing, and definitely an exciting announcement. But work is certainly not done, especially with, projections of future young families coming here. But yeah, I'm very excited. So congrats to the hub on that announcement, because yeah, definitely exciting news. So as Anne had said, we're sort of open for Q&A. Maybe if someone has a question, if they just want to raise their hand. Heather, we'll start with you.
Hi, I'm Heather Ford, and I work with the Food to Share organization. And one of the things I was wondering when Anne was going through the presentation, good presentation, Anne, was the part that volunteering could play in making people feel connected. Just from my own experience, I know that our organization, we get together and we cook. And I think people enjoy the cooking sessions and they get a lot of benefit personally from them. And one of the things that I've noticed over the last couple of years, or I guess since COVID, is that volunteering has really fallen off. And I don't know if there's a way to, for the county or the county foundation or some organization to help with volunteering, and maybe it exists, I'm not sure, but a place that people can go to find out what they can volunteer for, especially new people to the county, or anyways, thoughts.
I'll pass it over to Anne to talk about the volunteering aspect, but in terms of organizations, there's Volunteer Information Quinte.
Hastings Quinte.
Hastings Quinte. And they are an excellent resource in which they are essentially a volunteer database of opportunities. So they are a great place to put volunteer opportunities and for people to find opportunities to volunteer. And the one thing I'll say about volunteering is the best way to get people to volunteer is to ask your friends and family, because they have a very hard time saying no to people. So ask people, because that's some of the best way to get people.
Thanks, Dilly. That's actually how I got pulled into volunteering. My husband's aunt pulled me into helping with the North Barrysburg Recreation Committee. But think about that. That was just at that point in time, we'd had a blank field donated, and now look at what the Wapoos Recreation area is. Amazing what volunteers have done there with the help of the municipality always. But just to reinforce what Jillian said, volunteer Hastings Prince Edward. They used to be Volunteer Information Quinte. So they're really trying to do more work in Prince Edward County, and I think that we can assist with that. They are actively involved now with the Food Collective, and so what the services that they provide, they're a not-for-profit organization. They'll keep databases specifically for certain organizations. So Heather, for example, the Food to Share, you could let them know exactly what you're looking for. They can do vetting, they can do training, they can do follow-ups for volunteers. Retaining volunteers is always part of the challenge in training them. I know that Community Care for Seniors, for example, manages, I think it's over 400 volunteers. But they have quite a process. They've got a 10-step process that they take the volunteers through. So, it's a lot for small organizations to be able to do that. Volunteer Information, Hastings Prince Edward can do more of that. So maybe County Foundation can play a role. I've been thinking about this for a while in helping just to get more awareness of those services in our community. And with that, hopefully find ways to re-engage people in volunteering. That's one of the huge strengths in our community is volunteering. And and I think the pandemic has really been detrimental in that. Some people just still not getting out, and some of our volunteers have aged out as well.
Yeah. And I think that's a problem across so many communities, that volunteerism is down across, the country. And so I think, especially in terms of not only it being good socially, there's a lot of health benefits to having those social connections and to getting out and meeting people. And my mom's just moved to Campbellford, and so I was like, we should get involved in, different organizations, because that's one of the best ways to get out there and meet people.
For sure.
Yeah. Is there any other questions from any of the listeners?
If sometimes I'm a reflective thinker. Sometimes I don't think of questions at the time. If you have questions, afterward, don't hesitate to email me. Most people know how to reach me, and that's fine. And also, if your organization is looking for data and you just can't see what it is that you're looking for in that online website, again, reach out. Sometimes I can dig deeper for specific data that organizations needs.
Mhm.
Glad to do that.
Okay. Well, thank you everyone for joining for the webinar. As I mentioned, it's going to be available online. So if there's someone in your network that you think would benefit from listening to this, please share it. This is a great resource, I think, like the vital signs reports, the well-being dashboard. There's constantly more work and more information that we're uncovering and looking at. And we're always happy to dig further, as Anne mentioned, if there's particular data that you're looking for. So thank you very much for tuning in, and please share. So thanks all, and we will sign off there. Have a great rest of your
Thanks,
day.
everyone. Okay, bye.